Hi, welcome to the presentation about the blood donation awareness program. Here we are going to discuss about the blood donation. So here, first of all, introduce ourselves. We are from Doyara. So here in Doyara, we are working on the beam concept. So here beam means B for blood, E for educational support, and A for some awareness programs, and M for the medical support. So here, blood donation is the most important donation which is required for the people. There is a sayings is that okay. So here now the presentation is related to the blood. Okay. So here first why we have to donate the blood. That is the most important thing we have to cover. Why? There is a saying the best donation is the blood donation in this world. So here the reason why we are donating blood is to save the lives, of course. And we have to don't want to lose our loved one, so we have to donate blood. Maybe the blood which is required for us also it may happen. One day will comes, maybe we also need blood. So that means someone has to donate blood. So that is the main thing. Donation blood is most important thing in the human beings. Okay. So here now we are going to see some important questions which will rise in the donors, and for that the answers I'm going to give. Okay. So before get into that, everyone know there is some blood called universal blood. Any idea what is that? That is O negative. O negative blood is the universal blood which is donate to all the remaining blood group bloods. So you can see the O negative we can donate to all type of blood group people. So that is the universal blood. For the universal donor blood we can consider the O negative, and for the universal recipient means AB positive. So that means the AB positive people can get blood from all the peoples. So here the thing is that most probably for the particular blood, the particular person from the particular blood group, the same group only most probably we have to donate. If it's a rare situation, there is a shortage of supply, then only we can think about the alternative solution. Okay. For example, if the O positive patient is required of blood, we have to prefer the O positive only. But unfortunately, if there is a shortage, we can't able to get, but we have a O negative means, then we can use the O negative. For A positive patient, we have to provide the A positive only. But if there is a requirement not that, then we can go for the A negative like that. So this is the way only the universal combinations are occur. Okay. And the next thing what we are going to see is that who can donate blood? Who? The person who are fit and healthy can donate blood, and who have the age 18 to 65 can donate blood. And so these are all the conditions. Okay, if you have this criteria, then definitely we can donate blood. So that means the human has to be fit and healthy, and his age has to be between 18 to 65, and have a minimum 50 kg weight, and the pulse rate has to be 50 to 100, and the hemoglobin has to be 12.5 minimum at least, and the donor can donate every 3 months. Okay, so this is the eligible conditions and criteria for donating the blood. So the next question, who cannot donate blood? Yes, there is a thing that one day if you consume the alcohol or smoke, you can't donate blood within a day. Within a 6 months, if you have a tattoo, if you are undergone any dental extraction or root canal treatment or dog bite, you can't. If within a year, if any surgery or typhoid, malaria, chickenpox like that, if anything was infected, then you can't donate. Or a lifelong who have the cancer, asthma, So like this, anemia, heart disease problems. So who are having this type of issues, they can't donate blood. Okay. The one thing I can say for them, take care of your health. So here, if you are planning to donate blood, what are the things you have to do? Before donating blood, we have to eat some rich iron rich food. Stay hydrated. Drink some water and have some drinks, energy drinks, so that you can avoid dehydration in your body. Take adequate rest before the day. Take good sleep and wear some loose clothes. Some people wear tight clothes so that they can't able to take the blood. So just wear some loose clothes. Avoid fatty foods day before day. So too much oily foods and all. So we can avoid it so that we can maybe good things. And after donating blood, what you have to do? Obviously, the same thing. Have a good, healthy, rich food snacks. Have some extra fluids. Drink more fluid, at least half liter, 500 ml liter drink we can give. 500 ml water you can drink. Avoid alcohol and smoking at least for 24 hours. At least 3 days or 2 days you can avoid it. That is better for you. And don't expert yourself. Don't do hard works. Always be relaxed and do your work. Take some rest. That will be helpful for you. And be dedicated to the bandages because the bandages, if you put means at least 4 hours, don't remove the bandages. Maybe sometimes the bleeding may occur if the bandage was not put or means just hold your hands first for a few minutes. Fold your hands behind along your above the chest. Just hold like that, and then you can the things will be reduced and it will be controlled. So, so these are the things we have to take care after donating the blood. So, is giving blood is safe? Yeah, donating blood is safe because if you are fit and well after doing all the eligibility criteria, then only you are going to give a blood. So definitely it is safe thing because after checking all your body condition, then only the doctors will allow to donate your blood. And also the materials which used for taking the collect the blood, the needles, blood bag, everything is not a reusable one. So definitely it's a sterile pack. So that is the things. It will be always a safe thing. And another question will hurt whether it will hurt during the blood donating. It's not hurt, but it's like a pin prick. Some pin if you use to prick, right? So that's like a small sensation will be there because it's a needle we are going to inject. So definitely there is some things are there, but there is a safe, no need to worry about it. Okay. And here, what will we feel after giving the blood? Yes, we gave a life. We give a gift of our blood to a save one life. If you are saving a life, that give a joy for a family. So that is a different feel. If you give or donate, you can feel that moment will be a more important thing. Okay. So here now we are going to see about the platelet donation. Blood donation, just we seeing the criteria conditions. The same way the platelet donation. What is the platelet donation? Platelets are the tiny element cells in our blood, which actually used to clot and stop bleedings. And these platelets are more important for the cancer patients while doing that chemotherapy treatment in, when the body bone marrow is damaged and for the blood cancer patients and all. These platelets are more important. And also for the dengue fever. The dengue fever cause the platelet will reduce. So for that also we need the platelets. Here if you can see the platelets if you take collected means it will be live for 5 days. So that means the patients required within a 5 days on we can use the platelets. So most probably when the requirement is there, then only the platelet donation will be most probably used. Not like the blood donation, which will take and we will preserve for some days and we can use for the patient. Not like that. Platelets life cycle will be 5 days. So accordingly only the platelet donation will be taken care. So here some reference, we can say that every 15 seconds someone need platelets. And how the platelets donation process is occurring is, the blood is drawn from the donor and it was separated into different components, the white blood cells, plasma, platelets, like that. If the platelet is our requirement, that will be separated, and again that unused components are returned to the donor. So this process is called apheresis process. Okay, this is the thing which is going to happen in the platelet donation. So still many more things we have to know about the platelet means. So here the eligibility criteria is same as the blood donation only. And here before donating the blood, the donor will undergo a blood screening test to evaluate whether he is eligible to donate platelets or not. That eligibility check will be done, checked by the donor. They collect some blood samples and the checking will be done whether you have we have a more count of platelets, whether you are eligible to donate platelets or not. The checking will be done, then only you can able to donate platelets. And also the donor cannot donate platelets if he takes some aspirin, some medicine or meditation later within last 48 hours. Platelets can be donated every 2 weeks. That means within a year, 24 times also we can donate. But blood donation every 3 months means maybe most probably 3 times or 4 times only we can donate in a year. But platelets we can donate 24 times. Every 2 weeks or 3 weeks we can be able to donate. And the time duration for blood donation, it's take 20 to 30 minutes max. But in the platelet donation will take maximum 1 hour, 2 or 3 hours, depends upon the machine what they are dealing with. Okay. And still some more points if you want to say, most probably the platelets count within from 1,50,000 to 2,50,000 per microliter in the blood. The common normal donors will have. But if I come to the dengue, the reason why the platelets are required was most probably if the dengue affected person, if you see, the level of platelets will be reduced below 1 lakh. Even some percentage of patients have low level of less than 20 lakh, 1000 also will happen. So in that conditions, only most probably these platelets requirement is there. So that platelet transfusion is required to take care of the patients. So this is the thing that's happened for the dengue patients. And the cancer, that is the most problematic disease or health issue in our world. So obviously some people have know that cancer dates of 4th February, right? So here actually what is the cancer first of all? Cancer is a disease within some of the body cells grow abnormally and spread to the other part of the body. It will form in any part of the body. It's formed like a tumor, a lump sum of tissue. It's not like that all the lump sum of tissue, the tumor is not cancer. It may not be a cancer. We have to check the doctor and we have to examine and we have to find out whether it's a cancer or not. And which is the most thing cause the cancer? Mainly, everyone say from our childhood, the bad habits, smoking, drinking, and eating whatever and become overweight and taking too much ultraviolet radiation from the sun or using the tanning beds. In most probably in the northern, in eastern, western countries, they are using that tanning beds. So these are all some of the main causes for the cancer. Here, a small question. How many types of cancers are there? Any idea? Here, nearly 157 numbers are there as per the cancer.gov website reference. So here, alphabet wise, what are all the cancer are there? I just listed out. Many things are there. You see A, B, C, D, E, F, G, like that. For each and every alphabet wise the cancers I just listed out here. And here the 13 most common cancer types are listed out here. The breast cancer, lung cancer due to smoking, and then the prostate cancer, that is the abdomen, or a colorectal cancer, which is in the large intestine, or the skin's cancer, or bladder cancer, or white blood cells cancer, kidney, uterus, blood, pancreas, neck, liver. So like that, then a different part of the body we have a different type of cancers because of not following the proper hygienic food, not taking the proper hygienic food, not having some proper exercise. So different type of cancers are there. I don't want to go in depth why how the cancers are formed. It's not like, but everyone know about these are all the cancers. So here what happened for these cancer patients? There are many different treatments are going to happen. Radiation therapy, where we are using some high energy X-rays to treat the part of the body where the cancer. And it's chemotherapy. Chemotherapy is using some drugs to destroy the cancer cells. It's also used to slow down the growth of the cancer cell. Okay, and then if it is more severe, then we go for surgery to remove the cancer, the tumor parts. And there is another treatment called bone marrow transplantation, where there's a therapy of for the bone marrow, which mainly used for the blood cancers and all. This bone marrow transplantation treatment will be taken. Okay, so here what we are going to do for this cancer patient, what support we are going to do, mostly the fund and the blood. Fund who can able to give, they can give, but the cancer treatment is not that much easy. It more lacks. Many peoples has to join together and have fund to take care of the patients. But as a single person, how we are going to help? By donate your blood and donate your platelets. So that is the thing today I'm trying to convey for you people. So here what I'm trying to say is that the human body what need is that proper food, proper sleep, proper exercise. That's it. If you give this on time, you have a healthy life and you can live lifelong and you can enjoy your life. And what the human body avoids, the processed food, packed food, tobacco, alcohol. Avoid that and live a healthy life and enjoy the each and every moment with your family members and friends. Take care of your organ. So here, if you see, only 4% of the eligible donors give blood, and most of them are above the age of 40. Just 14% of these who can regularly are aged below 30. So here, many people are listening to this. We have to be a change. Come forward and donate blood and platelets. If possible, give platelets and help the needy people on time. What I'm sharing is that so these are all the donors who supported us and donated their blood platelets for the many people the last 5 years. So as a NGO, we want to encourage them and give us support. So for that moment, we are giving these posters and we are displayed in our social medias. So this is the thank you message for all the donors who donated and who are planning to donate, who are going to donate in the future for everyone. Thanks for the donation. Thanks everyone. Okay. And if you want to contact us, you can contact us on this social media accounts. We are ready to support at any time. Thank you. Live a healthy life. Bye everyone.